IVAR constitutes a novel approach to immunotherapy because of its multifaceted activities. It has anti-cancer, it inhibits the growth and spread of cancer cells, works by targeting multiple pathways involved in cancer development and progression. Anti-inflammatory, reduces inflammation throughout the body. This is beneficial for a variety of conditions including arthritis, inflammatory bowel disease and asthma. Antioxidant, we have already seen in the previous slide, so we can go on. And also we have already seen this slide, it has a GCMF-like activity, antiviral, and because of all these activities is indicated in a number of diseases as shown in the next slide that we have already seen. Now, here I shall focus on IVAR in cancer, AIDS and viral infection. The immunotherapy of cancer for IVAR has to be considered a new call-ace vaccine. IVAR constitutes the development of an alternative type of immunotherapy that traces its origins to the 19th century when Dr. William Coley from New York successfully treated inoperable cancer patients with his vaccine. Despite the well-documented successes, the vaccine did not survive Coley's times and was forgotten and neglected for decades in favor of radio and chemotherapy. In the mid-50s of the last century, the concept of a therapy based on stimulation of the immune system re-emerged from oblivion, even though with a profoundly diverse connotation. The interest in this approach to cancer has grown exponentially ever since, up to the point of appointing immunotherapy of cancer the breakthrough of the year in 2013. IVAR works by empowering the immune system so that the cells of the immune system can find and kill cancer cells and cells infected by viruses. How do we know that IVAR actually stimulates the immune system? We can use ultrasonography to study the human spleen. Most cells of the immune system reside in the spleen, among these macrophages, the main target of IVAR. When macrophages are stimulated, they release nitric oxide, a molecule that kills cancer cells and cells infected by viruses, as demonstrated in the article shown in the next slide. Here it says, macrophages, cytotoxic activity against viruses, bacteria, fungi, protozoa, helminths, and tumor cells. Nitric oxide also causes vasodilation. Observing vasodilation suggests increased activity in the spleen, and thanks to increased blood flow, increased number of immune cells directed toward their targets. Using a technique that is called echo-color Doppler, we can measure blood flow in the human spleen. The following slides show the increase in blood flow, spleen activation, and therefore immune system activation 15 minutes after administration of IVAR. In this type of observations, IVAR was administered sublingually, so that it could be absorbed almost instantaneously. This further demonstrates the high degree of flexibility of IVAR, a product that can be used in a variety of manners so to achieve a great number of results. This is a human spleen before assumption, and we can see the small blood vessel. And now see what happens after 15 minutes after you take IVAR. There is a great increase in blood flow in the spleen. This is blood. And this is another slide. Here you can see all the blood flow in the spleen. This is the human spleen and all the blood flow. So this clearly demonstrates that IVAR is able to stimulate the macrophages in the spleen. And what happens when activated macrophages encounter a human cancer cell? The following slide shows what happens when activated macrophages encounter a human cancer cell. This slide shows a co-culture of activated macrophages and human breast cancer cells with Papa Nicolau staining. The activated macrophages are visible as small cells with a roundish dark nucleus. A large cancer cell with a pale cytoplasm is evidenced by the large red circle. The apoptotic nucleus of the cancer cell with fragmented chromatin is evidenced by the small red circle. The two activated macrophages indicated by the red lines are destroying the cytoplasm of the cancer cell. In a very short time, the cancer cell is dead through the physiological mechanism of apoptosis, and macrophages clear its debris so that nothing of the cancer cell remains. So now, this is the cancer cell. This is the dying nucleus of the cancer cell, and these 1 and 2 are the activated macrophages, and they go like an assault against the cancer cell to kill it. The efficacy of immunotherapy observed in vitro is paralleled by excellent results observed in vivo. Over the past few years, we have observed hundreds of patients taking IVAR for a variety of conditions where natural immunotherapy was indicated. As far as cancer is concerned, I wish to share the following story from a lady with ovarian carcinoma. Please take a look at the dates of the emails. She went from very high ovarian cancer markers to cancer-free in less than 2 months. This story is representative of many others observed in a number of different cancers that provided qualitatively identical results. So this was February 6. The cancer marker was 488. Normal is 35 or under. March 20. The cancer marker has gone down to 205. And now March 24. I had the operation. There was no cancer. Thank you again. The following email refers to a patient with breast cancer. I will read only the line that is important. My PET scan came back cancer-free. Yippee, over the moon. Now please, I kindly ask you to pay attention to the following 3 or 4 slides, because now I introduce a revolutionary concept in the field of medicine, in particular in the field of cancer, and how IVAR works. As you know, cancer therapies, chemotherapy, radiotherapy, they try to kill the cancer cells. IVAR also kills the cancer cells, but it does much more. It eliminates the cause of cancer. And now I explain. IVAR targets the root cause of cancer. This is an absolute novelty that may change the history of medicine. Up until recently, it was believed that cancer was the result of mutations occurring in DNA. Mutagens, such as chemicals or radiations, would cause mutations in critical genes, and cancer would develop, progressing from benign to malignant and eventually aggressively metastatizing. While mutations are obviously present in cancer and highly important for diagnosis and prognosis, they are not its root cause, but rather an effect of something that happens in other cell organelles, the mitochondria. This revolutionary theory of cancer was proposed several years ago by Professor Thomas Seyfried of the Boston College of USA. In the next slides, I shall summarize the theory of cancer as a mitochondrial metabolic disease. Emerging evidence indicates that cancer is primarily a metabolic disease involving disturbances in energy production through respiration and fermentation. The genomic instability observed in tumor cells and all other recognized hallmarks of cancer are considered downstream epiphenomena of the initial disturbance of cellular energy metabolism. The disturbances in tumor cell energy metabolism can be linked to abnormalities in the structure and function of the mitochondria. As demonstrated by Seyfried and colleagues, mitochondria of cancer cells lose their ability to produce energy using oxygen. Alteration of energy production by mitochondria is the root cause of cancer. The next sentence is very important. If mitochondria of normal cells are transplanted into cancer cells, these become non-cancerous despite still harboring mutations. Transplanting mitochondria from normal to cancer cells can be done in a petri dish in a laboratory, but is not a feasible anti-cancer strategy. However, restoring the ability of mitochondria to produce energy is feasible, and this is exactly what IVAR does. How can we evaluate the ability of IVAR to restore the production of energy by mitochondria? We can measure the isovolumic relaxation time in real time in any patient. The isovolumic relaxation time is an interval in the cardiac cycle from the aortic component of the second heart sound, that is, closure of the aortic valve, to the onset of filling by opening the mitral valve. The length of the IVRT is inversely proportional to mitochondrial energy production. Prolonged IVRT indicates a poor energy production and myocardial relaxation. For this reason, IVRT is used as an indicator of diastolic dysfunction. IVRT is reduced in cancer and other diseases such as HIV infection and chronic fatigue syndrome. The following slides show how administration of IVAR decreases IVRT, thus demonstrating that IVAR actually improves energy production in the mitochondria. Now, this is complex, but just look at this number. This is the IVRT, 241, before IVAR. The percent decrease is 23%. This corresponds to increase in energy production by 23% in only 15 minutes. IVAR is the one and only product in the world able to restore mitochondrial energy production, thus targeting the root cause of cancer and many other diseases where energy production is deficient. Among these, HIV infection. As far as HIV and AIDS are concerned, it is important to remember the words of Nobel laureate Professor Luc Montagnier, the co-discoverer of HIV. As long as you have a good immune system, you will get rid of the virus. In viral infections and immune deficiencies, IVAR works on multiple fronts. IVAR interferes with the early stages of HIV infection by blocking the virus from entering target cells. It enhances the immune response, helping the body fight off the virus more effectively. It inhibits HIV replication. It is non-toxic to human cells, making it a potentially safe therapeutic option. The following slide shows an example of the antiviral activity of the major antiviral component of IVAR on the syncytia formation in HIV-infected MT4 cells. A is the control, and B and D increasing concentration of the antiviral sulfated polysaccharide of IVAR. So you see, this is the control, and then you have IVAR, and you see the decrease in the number of the cells infected by virus. This slide shows how the sulfated polysaccharide of IVAR modulates antiviral mechanism by inhibiting attachment, penetration, interiorization and coating, transcription and translation process. The clinical effects of IVAR consumption in HIV/AIDS consist in increase of CD4 cells, decrease of CD8 cells, and decrease of viral load. All these are the hallmarks of a successful immunotherapy. IVAR and other viral infections. The antiviral activity of the sulfated polysaccharide, that is the major antiviral component of IVAR, is not limited to HIV. It is effective against all types of viruses. This slide shows the efficacy against hepatitis B virus. In this subject, the viral load went from more than 5 million units to 12,000 units in less than 5 months. The antiviral activities shown in the previous slides primarily refer to the sulfated polysaccharide component of IVAR. However, also zinc, that is highly structured in IVAR, plays major roles in supporting the immune system and fighting viral infections. In IVAR, zinc self-assembles with fucose of the sulfated polysaccharide component. Such a structure amplifies the immune-supporting and antiviral activities that are typical of zinc. The following slide shows the activities of zinc that are amplified in IVAR. However, since we are running late, I will not go through all the health-supporting activities of zinc that are well known. The only thing I want to say is that in IVAR, the known activities of zinc are highly amplified by the complex with fucose. I want again to reiterate this concept of activities. As I said in a previous slide, the overall supporting and antiviral activities of IVAR are not 10 plus 10 plus 10 plus 10 equal 40. They are 10 by 10 by 10 by 10 by 10, 10,000. This is possible thanks to the self-assembly of zinc with a fucose of the sulfated polysaccharide according to this molecular formula that I'm not reading because it's too boring. We are at the conclusions. In silico, in vitro, and in vivo evidences demonstrate the high efficacy of IVAR in supporting the immune system and therefore its indication in a wide variety of diseases where dysfunction of the immune system is involved. In this presentation, I focused on cancer and viral infections ranging from HIV to HBV. However, as the slide shows, IVAR is indicated in a number of conditions. We are observing hundreds of subjects who are assuming IVAR for the most diverse conditions, and we witness formidable results almost on a daily basis. IVAR is a highly innovative and unique product as described in the previous slides. The supramolecular structure described in the previous slides are endowed with drug-like properties. However, since IVAR constituted by fully natural components, it can also be classified as food, functional food, or supplement according to each country's regulation with obvious advantages. In its design, I took care to avoid any risk of reverse engineering. In other words, even detailed analysis of the finished product is not sufficient to copy or clone the product. The US patent application further reinforces the protection of its intellectual property. IVAR was designed with the flexibility necessary to develop entire lines of products, such as injectables, parenteral, topical, nutraceutical, or cosmeceutical compositions. In addition, IVAR can be engineered toward a specific subset of diseases. For example, one formulation of IVAR can be tailored for breast cancer, and another one for prostate cancer, one for HIV, and one for SARS-CoV-2. IVAR is designed to be manufactured by Danabiologics as health foods, health supplements, drugs, for the prevention and treatment of a variety of diseases as previously indicated. Since I am the inventor and developer of IVAR, I am committed to provide assistance to Danabiologics as far as manufacture and development of the product are concerned. The intellectual property and the exclusive manufacturing rights will give Danabiologics a formidable competitive edge and the potential to be a game changer in the field of medicine. Thank you.